When we talk about robotic joint replacement, how does that differ from regular joint replacement?
So this is actually a knee resurfacing rather than a knee replacement. The word is a big misnomer. You are undertaking a technology which is at the peak. Robotics and AI is trying to take a little more higher. Investing in your health. Whatever you're investing now, you will reap the benefits when you're 60. So start investing today.
Welcome to the OddsFitness podcast. Today we have Dr. Simon Thomas. He's the Senior Director of Robotic Joint Replacement and Orthopedics at Max Super Specialty, Shalimarbagh. And, with all the sort of, joint replacements happening, and now this has become a common phenomenon where, people have degeneration as a common lifestyle outcome, especially in metropolitan cities where movement and exercise, are seldom, you become dependent and codependent on so many people, and movement becomes very limited. Degeneration just becomes part of that process. And it's become one of the mainstream surgeries in many hospitals, where people are coming, getting their hips replaced, their knees replaced, and all those things happening. So, we wanted to know who is one of the most, one of the most skilled, and we wanted to find out who's somebody who's actually focusing on patient outcome and who's trying to focus on what can be done once the replacement has been done. What should one do to elevate their quality of life? Because most people who are getting these surgeries done are in a lot of pain. So, I luckily met Dr. Simon, and he had very interesting takes on how one can, improve their productivity, improve their, health span, enjoy life, and focus on the things that they like doing. And how does joint replacement done the correct way, or a joint replacement that has gone bad, how can it be fixed in order to make an individual thriving, no matter whether they're 60, 70, 80. And I think his vision for this entire field is very unique. So welcome to the OddsFitness podcast.
Thank you so much for having me here.
Right. So, Dr. Simon, first about you. What inspired you to, become a doctor?
You stumped me with the first question.
Yeah.
I think I will give you an honest answer to a very candid question. I'm a middle class, my parents, my mother was a staff nurse, and my father had a small business. And when we were young, I was told कि अगर डॉक्टर नहीं बने तो तुम भूखे मर जाओगे. ठीक है. So entire 12 years of my schooling, मुझे यही बोला गया कि यार तुमने डॉक्टर नहीं बना तो कुछ नहीं होता, तो या तो रिक्शा जाओगे या डॉक्टर बनोगे.
That's a very binary approach.
Absolutely.
Nice.
But that was how the middle class was maybe 20, 30 years back.
Right.
Okay. So I think those days are gone. But somehow it pushed me into कि भैया डॉक्टर बन जाओ वरना तो कुछ नहीं होगा.
Right.
So but then certain things I realized after becoming a doctor. And in fact, I can extrapolate that to, lot of other professions, not
Right.
just doctor,
Right.
a banker. See, have you ever gone to a bank? So you'll realize आपको फॉर्म दे देते हैं कि आप भर लो. आपको पता नहीं फॉर्म कैसे भरना है.
Right.
जब आप गलत भरते बोलते अरे तुम्हें ये नहीं भरना आता.
Right.
So I realized that for my patients also. When a patient comes to me, he does not know anything about the body.
Right.
If I expect him to know, then I am naive.
Right.
So I have, or anybody, not just a doctor or a banker, any profession, when you're sitting on this side and somebody comes to you for a consultancy, you have to treat them as what you would want for yourself.
Right.
And this is something which over these years has experience taught me. I had some bitter experiences in some hospitals when I was a child for my parents, especially my mom, and that also molded a little bit. So now I am a doctor. So I now know that even if you're not doctor, you'll survive and you'll thrive. One thing is there. So you don't have to be a doctor to survive.
Right.
But I've also realized that being a professional, it brings more responsibilities. And when a patient comes to us, it is not just, he's not coming for just a disease which has to be treated. A rickshaw wala coming with a knee pain, a person, an entrepreneur coming with a knee pain, both have just knee pain, but their aspirations are different.
Right.
The guy, the entrepreneur, has to drive, or he's driven in a BMW or in a high car. But the person who's on the road has to work hard. He has to lift weight. He has to do manual exercises. The treatment may vary. That is what a doctor has to realize. And this is also what the profession has taught me over a period of time. And that is why you also realize that different doctors have different opinions about the same disease.
Right.
और फलान डॉक्टर ने ये बोला, उस डॉक्टर ने वो बोला, आप किसकी बात माने? So the treatment is holistic. And I think here I am sitting in front of you, a middle class doctor still.
Right. Middle class, I think it's most people who aspire to be doctors, they usually come from
Yes.
middle class setup, because I've seen that they, they understand the common man's problem as well. They also understand that being a doctor is something that can contribute not only to their surroundings and society, but to their families, and they've seen both ends. So I think they're in that sweet spot of the right opportunities and at the sweet spot of changing the problems that they have dealt with. So I think those are contributory factors maybe, and also of course binary opportunities, like if you're not a doctor, you just don't exist. So,
Still, I'm sitting in front of you.
right. So what are when we talk about robotic joint replacement, how does that differ from regular joint replacement?
Yeah, I think first of all, I'll want to tell you one thing. The surgery of knee replacement is not exactly replacement. Like this table on which we are actually sitting on, this has got a senmica or a covering on top of that. Just like that, the bone ends which meet to make a joint, they have a cartilage covering on top of them. So with age, sometimes what happens is the cartilage covering gets worn off and the bones get rubbing to each other. That leads to pain. So what you do in this surgery is that you're not cutting off big chunks of knee or the bones away and putting new big metal pieces. That's not how it happens. What you're just doing is that you're actually creating, you're taking out the cartilage which is damaged. You're making it totally flat so that there's a raw area created. And on that raw area, you'll actually put a new cap on the top bone, that is a femur, and the bottom bone, that is a tibia. And then it actually starts to move, and the bones don't touch each other because the caps rub on each other. So that makes it pain free. So this is actually a knee resurfacing rather than a knee replacement. The word is a big misnomer. Replacement लोगों को लगता है अरे यार तो हमारा घुटना काट के अलग ले जाएंगे और नया कोई घुटना लगाएंगे. घुटना आपका अपना है, muscles, ligaments सब आपकी अपनी है. It is just that you will have a new cartilage cap, a metallic cap on top of that. Usually we used to do this in a manual way. So what happens is that we open the knee and we do the surgery and come out. I'll give you a very good example that, see, when you make tea, see, some people will make great tea, some people will make a not so great tea. How can we ensure that there is uniformity of the tea that is making? If we can say, rather than doing things from, andaze se, see, just by our eyeballing, if we can, everything can be, measured. See, maybe 100 ml of water, 5 grams of sugar, 2 grams of tea, boil it at this temperature for this much. Maybe that ultimately that also may not lead to, uniform tea being made. But this is how it can be. That's how robotics come into play. Robotics, what happens is that you actually get the patient's 3D model of the knee or the joint that you're operating on the computer even before you've started the surgery. So if I had to operate a person A, so in a conventional, I will actually open the knee, do the surgery, and just close it. In this surgery, what I will do is that I will make a robotic 3D model of that, and which I can view before the surgery starts itself. And after that, the 3D model is there, I can actually put the virtual implants, the virtual implants that I'm going to put on that patient on the 3D model. Then I can extrapolate how it's going to work. At this angle, is it going to move like that? At that angle, I can move like that. And I can do whatever, unlimited number of possibilities. I can do this, I can do that. And I'll finally, with my best experience, I can win for this patient, this is the best possible implant position. This is the best possible implant, even without doing the surgery. So that makes the surgery more objective. So the surgeon has a hindsight कि इस patient को इस particular position में लगाने से आपका result शायद better हो. I say shayad because ultimately, see, what happens to the body is for time to tell, and the technology is new. So, how it is going to behave in the next 20 years is for time to tell. But this time, it is very promising because it gives you a hindsight, it gives you a prediction of what is going to come inside. But having said that, the first and foremost thing I want to say also is that people who are getting a manual surgery, it is no way inferior to a robotic surgery. So let's get that message very clear. So people who are undergoing non-robotic surgery, please, you are not having an inferior surgery. You are undertaking a technology which is at the peak. Robotics and AI is trying to take a little more higher.
Right.
Whether it will reach that pinnacle, we need a little more time to say. But at this moment, in a short span of maybe last decade or so, we found that robotics helps in the early recovery much faster.
So when you say robotics, it's the estimation of the biomechanics of the joint and to extrapolate what circumstances or what type of, let's say, surgery needs to be done. Or you're actually talking about the robotics which are involved in the replacement of the surgery, replacement of the joint, in your words, of course, the resurfacing.
Yes.
So is that what you're talking about, or is it more to estimate these are the joint mechanics, these are the, let's say, bony spurs, or this is the degenerative part of it, these are the joint angles, this would be the ground reaction force, these would be the compressive forces, this would be the shear force, and that's the robotics part of it?
I think it's a very, very valid, and a very interesting question from somebody like you. I think that you have a great insight into the subject because, see, the estimation itself was just AI driven. It was called navigation, where we could actually see what is a knee like and what we want it to be. It's like the GPS. It shows you the way, but robotics is actually, it helps you do it also.
Right.
So it is not just about estimation at all. We will actually execute. So if I had to, put the implant in 2 degrees of some varus or valgus or some flexion or extension, these are technical terms, but the idea is that the implant position is a little away from what we usually put. We put that data into the computer, and the robotic arm will chisel the bone accordingly.
Right.
So the surgery incision is given by the surgeon, the exposure is given by the surgeon. Then we mark on the computer what we want to do and give it to the robotic arm. So instead of doing it by my own hands, the robot will do it automatically. And it is a completely safe procedure because robot is only following what you have given the path. It does not have it does not have the intelligence to take a decision whether to take a right or a left. If you ask it to go straight, it will go straight. If it is confused, it will stop. It will not take a decision. So a lot of people think, oh, robot में तो robot surgery करता होगा, surgeon के हाथ में control नहीं हो. That's not how it works. The surgeon makes the plan, surgeon feeds it to the computer, and sometimes it also happens that the bone is hard somewhere, the bone is soft somewhere, and the robot feels that it is going off way from the plan. It will just stop. In fact, it is so sensitive a system that when the patient breathes a little, too much, or there's a deep breath in the patient, the body moves, the robot is confused whether I'm going to cut wrong or not. It stops. So it is a precision instrument, it is an exact instrument, and it is totally in the surgeon's control.
So let's talk about outcomes. Robotic versus regular surgery. Are there any significant, reduction in errors or improvements in outcomes, recovery, all those things? Anything that you might
See, at the outset, when I answer this question, the first thing I will again say, the manual surgeries are also almost exact. So we cannot say they're inferior. We are not looking at a 90% accuracy. In a manual surgery also, we're looking at a 98, 90%, 99% accuracy. With robotics, we are trying. I will use the word trying. I'll be very objective. Rather than me, it looks like, oh, this is exact. No, we still, utopia or perfection, we're trying to achieve.
Right.
We don't know what is perfection. In fact, not just medicine, in any field, we don't know what is exactly perfection. But we're trying to improve perfection, what we have attained by manual surgery. So at the end of the day, the initial 3 weeks, the initial 6 weeks, the post-operative pain is lesser because the ligaments and muscles are released less. So because of that, actually, the when the muscles are damaged less, the ligaments are released less, the pain, that is initiated after surgery is also less. So surgeries are becoming little less painful. The therapy, physiotherapy, can be better orchestrated because the patients can concentrate more, he can cooperate more, and also the placebo effect, that I'm getting a better technology, that also makes patients feel that that I'm going to get better. So your mind is always of your body. So if you mentally prepare, oh, I've got a great surgery, you're actually half your therapy is also done, half your recovery is done. With this, in the first 3 to 6 weeks, patients almost attain a 90% recovery of their preoperative functions.
Wow. Wow. Um, you know, there was this one, I'm forgetting who was that tennis player who recently got knee surgery done, and he recovered just like that. It wasn't a replacement surgery, but with the way surgeries are going and the direction where technology is headed, people are recovering so much faster. I think also contributing factors could be, do you have you know good structural integrity, or do you have good musculature around that joint, which will definitely add to the mechanics of the joint after. So do you counsel patients on that as well, that maybe there's a preoperative, prehab, and then after that there is rehab? Do you have any of those as part of your practice?
I think in the last 20 years, uh, the, the patients who used to come for replacement, their mindset has changed dramatically. The age group has also changed. I'll tell you how. I think in 20 years back, patients had no belief in the surgery. They just did not believe the surgery was actually wonderful. They just thought it is actually a tukka, or a basically a chance surgery. They may get better, they may not get better. So they kept on waiting till they were almost bedridden, almost in so much of pain that the only thing they wanted was, डॉक्टर साहब थोड़ा चला फिरा दो, टॉयलेट बाथरूम चले जाएं, थोड़ा घर में चल लें, हम बहुत खुश हैं. These patients are elderly.
Yeah.
And I think in the last 20 years, the surgery has become so successful and patients have seen successful results. It has become more predictable that younger patients now come back. So now I see more of 50 to 60 age group patients coming. A few patients are even in between 40 and 50 also. So gone are those days when a majority of patients are more than 65 or 70 and we're operating. Now we see younger and younger patients. And these patients are very demanding, and they have the right to be demanding, because if somebody at 50 has much more demands from life than somebody at 60.
Yeah.
Their children are getting settled, they're financially just getting independent, children are getting married, they now want to roam the world. If you see, आप अपने दादाजी का सोचो, तो when you were younger, in fact my dadaji must have been only 55 when I saw him, ठीक है, and maybe younger also, but I have always this impression that दादाजी तो बुड्ढे हैं. But now the 50, they are actually at the cusp. The body is allowing, they've maintained themselves well, they're financially independent, they have the time where business and work is all settled. They have some time also. So they want to enjoy this time.
Yeah.
And when the knee or the joints troubles them, they want answers to that. They want solutions to it. And these surgeries are so wonderful that these are the patients who are getting solutions. So they just don't get the surgery to, do some simple exercise at work. No, they want to drive, not drive to work. They want to drive to Kanyakumari. They want to do mountaineering. They want to do exercises. They want to, do Ironman. And this is what, with certain catches, your body type, you can do. You can do.
Right. So, of course, your muscles around your joints and all of those things would definitely matter.
Yes.
Right. So, surgeries aside, what should one do to keep their joint health intact, irrespective of whatever whatever they've done in their life? They've lived a sedentary life. What can one do today to make sure that their joint health remains good or their bone health remains good?
I think the first thing that you should realize is that whenever you have a joint problem, you should address it. I'm not saying you should go to a doctor and see, but you start doing something about it. Mainly because, see, we all will have some problem with the joints with age. So you have to address it by actually preventive methods. And out of 100 people that I see, less than 5 need any sort of surgical intervention. Rest 95 to 97 people out of 100 will actually get wonderfully well by simple exercises, lifestyle modification, diet modification, and keeping the other paraphernalia in the body intact and having a great mind setup that everything is fine. So people have this understanding, oh, if I go to Dr. Simon, he will advise surgery. Or any orthopedic surgeon, he will advise surgery. That's not how it is. So the first thing is that you should do, is exercise regularly, maintain a good body weight, healthy diet. This looks very easy and very simple, but trust me, when you start to do it, you find it's not as easy and simple to do because you can do it on one day. I know a lot of people who do it in one day. I know a few people who will actually do it for a month. Very few people do it for a year, and actually seldom do it for a lifetime. So if you can actually do good habits for a long period of time, you will. So I always say this investment is like the SIP that you make for your saving. This is actually the fixed deposit you do for your body. Whatever you're investing now, you will reap the benefits when you're 60.
Right.
So start investing today, investing in your health.
Right.
And if you can do that, you'll be wonderful. What activities you should do and you should not do? You can do anything that you want. I don't want to restrict at all. The two activities which are detrimental for the knee are basically any actions which require you to squat too much, especially weighted squats that people do now in the gym. That is detrimental. And too much of sitting cross-legged. That means any knee action which wants the knee to hyperflex or bend forcefully, that is going to take a toll on the knee. And that may not happen now, that may happen over a period of time. Running, jogging, aerobics, Pilates, these are good for the knee. Cycling is good for the knee. And certain amount of pain that will come when you start doing these exercises, ignore it. Gradually, the body will overcome. Some certain supplements like glucosamine and things like that, you can intermittently take it. You don't need to go to a doctor for that. There are a lot of over-the-counter drugs which are now available, which are safe, which are effective. You can just get it, do some simple exercise, and life will be pain-free and happy.
What do you think about strength training?
I think strength training is a great idea, and it builds endurance and muscle mass. Because at the end of the day, if you've got a good muscle around the joint, it will actually overcome certain amount of joint problems also. Because the pain that you actually comes by joints grinding each other will actually reduce by good muscle strength. The problem arises when actually people don't concentrate on endurance. Everybody is concentrating now on bulking up. Bulking up is increasing your weight. It necessarily may not improve your muscle strength. I may be wrong on this because I'm not an authority on this. I'm an orthopedic surgeon. I think if you talk to a dietitian or somebody like you who's into health, may be able to give a better version. But I feel that there is no point bulking. You bulk to a certain extent, but not too much. What you should do is work on endurance. Your muscles should have, the strength to go a long distance. That will take you a longer way.
Right. What are the challenges that one faces post-surgery?
Actually, at the end of the surgery, we want all patients to have as normal a life as they were having earlier. So these implants now, they are actually capable of allowing you to sit down on the ground, do some basic work sitting cross-legged. You can climb up and down the stairs. So the implant technology and the designs have improved dramatically. So implant is not a problem. The problem is your own body. So over a period of time, what happens is that your bone density reduces, the implants lose strength on the grip on the bone because the bone becomes weak. Sometimes a polythene which was actually in between the bone that wears off, but the technology is so good, the materials are so good that the wearing is also very minimal. But so what ultimately will be a rate limiting factor for the knees to last a long time is basically your own habits. So you should maintain a good healthy lifestyle, maintain a regular weight, do exercises, not at the level of panic that you're exercising every day for the sake of it. No, but maintain general exercise for your body, holistic, improvement of the body itself. That's how it is.
Right. I recently had a friend whose mother had a knee replacement surgery, and the moment she got off to stand, which they do right after the surgery, her bones, sort of slid, and I don't know, for some reason, maybe lax ligaments or whatever it is, she had that problem. Then another thing that happened was that when she was supposed to have the surgery again, they opened up the wrong knee. That's another medical error that sort of happened over there. And then when the surgery was done again, she ended up with sepsis. So I've seen this live example in front of me. How common is that, and what should one do as a doctor, or what can a patient do in order to make sure that they are protected against such situations?
See, I think the chance of you have a complication, especially infection, is less than 0.5%. That means out of maybe 100, only less than 1% should have an infection. But we see more and more of infection mainly because the numbers are increasing. So thousands and lakhs of surgeries are being done, and there'll be the law of averages will catch up. You will see infections. And the unfortunate part of this is that after any implant surgery, you have a lifetime risk of getting some infection. Even with patients who don't have any implant in them, they can have pneumonia, they can have UTI, they can have a stomach infection. Like that, when the implant is there, then also there's a chance that the infection is there. So it is not that people with implants have a higher chance of infection. First of all, that's not how it is. But implant infections behave in a different way, because what happens is that normally हमें pneumonia होता है, तो what happens is we give medicines. The medicines go into the stomach, they're absorbed into the bloodstream, and the bloodstream goes into the areas where actually the disease is, and the bloodstream covers, the antibiotic goes in the bloodstream, and the disease is washed away. With the implant, the problem is the bacteria or whatever bug is there which is covering the implant is actually forms a protective layer on top of it, which is called as a biofilm. A biofilm, what it does is that it will actually एक सुरक्षा कवच बना लेता है अपने ऊपर. So you keep on giving antibiotics, IV, oral, years and years. Still, there will be circulation में antibiotic होगा, but it will not percolate into the biofilm. So the bacteria is sitting right under the implant or over the implant with a biofilm on. So if that is the case, then you will need a surgery. The surgery, if the infection detected on time, is a simple surgery. You just open the knee or the joint again, wash it with lot of water. हमारे घर में गंदगी तो क्या करते हैं, पानी से धो देते हैं अच्छे से, पोछा लगाते हैं, झाड़ू लगाते हैं, अच्छे से धोते हैं, वो गंदगी निकल जाती है. अनलेस एंटिल ये जैसे टेबल के नीचे कुछ बहुत गंदगी है तो टेबल हटानी पड़ेगी, उसके बिना हम उसको क्या कहते हैं क्लीन नहीं कर पाएंगे. Just like that, if the bug has gone inside the implant and it is sitting into the implant in the bone, then washing it on top will not help. In that case, implant will have to be removed, and then we will have to put a cemented mold inside so that it acts like a temporary joint, and the cemented mold will have antibiotics inside, will leach inside, and will give IV antibiotics also accordingly. And on that, the patient walks over a period of time, and then after the implant is, if that bed in which the implant is to be done again dries up, the infection settles, then we did redo implant. This is called a two-stage revision, in which in the first stage we will remove the implant, do a thorough debridement, washing, and thorough taking out of all dead bone, all infection like tumor we treated, and create a bed which is sterile and free of infection. And then we'll put some antibiotic spacer so that antibiotic comes inside and it actually percolates a biofilm. Then in the second stage, we will actually redo or re-put the implant again. And the patient is mobile during both the stages. That's how it is.
Right. Many cases where people have this problem, because it's an old age problem, people end up with lifestyle diseases, diabetes limits healing, and also other repair mechanisms, and they have, weak muscles to begin with, because if you have a lifestyle diseases, most likely because you've not been active, and of course the joint problem also comes from that. So, when a patient is looking at this, he has these questions. He or she has this question that, I've heard this, I've heard that, this happened to this person. And what you're talking about is another surgery, a lot of antibiotics. Then they have questions like, what if I am resistant to antibiotics? I develop antibiotic resistance. And late stage, if I get pneumonia, what am I going to do then? How does one answer these questions?
I always see when patients come, डॉक्टर साहब आपके क्लिनिक के बाहर दो लोग बैठे होते हैं, उनको तो इन्फेक्शन हो गया है, ठीक है, उनको घुटने में दर्द है. तो मैं हमेशा बोलता हूँ, see, my clinic is not a showroom. My clinic is a workshop. So when you come to a doctor's clinic, you'll see a lot of patients with problems. So, but I always tell patients that the ratio the chance that you will be wonderful and happy is much, 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 much more than the chance that you will have a problem. I'll give you an example. When we all drive back from here, there's a theoretical chance that we'll have an accident today. But we don't think about that when we go out, drive, because we drive safe, we maintain the car nicely, we follow all rules, and we leave 2% to the Almighty that we will be taken care of today. But still, we will see some accidents every day on the road. But that does not deter us to drive again. That's the same with surgery. I see all these problems, but I am very happy to say that this is a very minuscule part of the problem.
Right.
But unfortunately, people who get happy, wonderful, they don't talk about it much. But people who are unhappy, they have no option but to talk about it because they have to share their problem to in order to get a solution. So you see a lot of people who are unhappy, but I know a lot of professional dancers, TV stars, even some movie stars who have had a joint replacement. You don't even know about them. Some of them I've operated.
Wow. There's this one very viral video of this old lady. She's doing a deadlift, and she's doing numerous exercises. She came on the BBC as well, and she had a joint problem, arthritic knees, I think, but she went on to exercise and completely eliminate the problems associated with her poor lifestyle or health span or quality of life. What would you have to say about that?
I think I've already answered this, that majority of people who come with knee pain don't require a surgery.
Right.
So out of 100, only 3 or 4 or maybe 5 require a surgery. So if this lady, when I see these examples, I see this was one of those patients who in the 95 who did not require a surgery. If somebody advised a surgery to this patient, that was an overkill.
Right.
So it is wrong to say that she needed a replacement and she avoided replacement by doing exercise. That's not how it is. She most probably did not need the surgery.
She was in
the 95.
She was in the category where she didn't need the surgery and she could have taken.
Yes. So a lot of times I tell people, and again, this is a lifestyle surgery. I have a pain, you have a pain. Okay? The intensity of pain is same. You may say it's nothing. I'm nothing. My mind is strong. Somebody may say, oh, I'm dying in pain. So for the same pain intensity, somebody may choose a surgery, somebody may not choose a surgery. It is very subjective. So a lot of people ask me, Dr. Saab, I am not decided whether to choose surgery or not, what to do. So I ask them, do you need a painkiller every day? Is your activity getting, modified to such a level that entire family and friend circle do something, you're not able to do that? Are you actually slowing down? And what is your age? And how much are you willing to suffer?
Right.
Okay. So if these questions are the one which you have to answer. So there are some people who say, Dr. Saab, I know I need a surgery, but do give me some treatment, some medicine, some exercises that even if I am 70% better, we're happy. Why we are happy? 30% मैं झेल जाऊंगी या झेल जाऊंगा. I will live with it because my surgery is avoided. That's a good trade-off.
Right. No, that makes a lot of sense, and that's what decides between a good practitioner and somebody who's just trying to. And I think Dr. Simon is one of those who will always guide the patient in the right direction, because this is probably the cornerstone or the foundation that a medical practitioner should have. It's always patient first.
Yes.
So,
and this surgery is never the surgeon's call. The surgery is a patient's call. So people ask me, what if I don't get the surgery done? Nothing's going to happen. You'll be in pain. That's all.
Right.
You'll be in. And if you delay the surgery, if you get the surgery maybe 10 years down the line, you may have the regret that mere 10 saal or better ho sare. But that is immaterial.
Right.
Nothing catastrophic is going to happen if we don't undergo surgery. It will be painful, it will be slow, but life will go on. So the surgical call, Dr. Saab, aap batao surgery ki zarurat hai ki nahi? So I can only suggest, I can hint that you will benefit out of it. But if you don't undergo surgery, it is totally your call. And nothing is going to go wrong if you don't undergo surgery. So please don't feel pressurized to undergo surgery. Come happily, come bold, and with a good mindset, and the result is going to be amazing and outstanding.
Amazing. Do you have any questions?
I think I'm done. I think we want to talk about the odds जो हम पहले बात कर रहे थे कि the post operative. What can we do after surgery? What is the expectation of the patients after surgery? Okay. and what is, are patients completely normal, ठीक है, after surgery? That's what you should ask me. Then I will just say a little brief, and then I think we'll wind it up. That's how it is.
So, what do you want me to ask exactly?
Uh, 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 what is the final? What should the patients undergoing knee replacement should have? What should be the expectation of patients who undergo surgery? What should be the expectation? And is the post-operative and one more thing is that, is post-operative exercises mandatory after surgery? Because patients keep on getting physiotherapy and exercise done for 6 months, 1 year. These two questions I think you should ask. First, the exercise part you should ask, and then what is
Okay. Doctor, is exercise and physiotherapy rehabilitation mandatory after surgery?
That's a very valid and great question. See, some amount of therapy, some amount of exercise is important because you want to regain muscle mass, you want to regain muscle endurance. But that is only for a limited period of time. So I see a lot of patients getting exercise, therapy, and all done for 6 months, 1 year. It's not needed. What you need to do is not. So I keep on seeing physiotherapist and exercise, or modenge, gutna modenge, we'll get you 120-degree, 130-degree range of movement. That's not needed. Majority of activities which you would want to do in daily activities like climbing stairs, going up and down the incline, it requires you only 70 to 80-degree range of movement. So even if the range of movement is not great, the patients may have a great result. So let's stop obsessing about और मोड़ रहा है घुटना. सर्जरी का सक्सेस घुटने की मूवमेंट से नहीं है. ऑल्दो रोबोटिक्स और टाइम पे आने से घुटना अच्छा मुड़ता है, बट अगर आपका घुटना कम मुड़ रहा है तो प्लीज डोंट फील दिस एन इनफीरियर रिजल्ट. Second thing is that exercise, initially it's okay, but afterwards you should do regular exercise for your happiness. You want to go swimming, you want to go mountaineering, you want to go jogging, do that. Do that for your own happiness, not because you want to actually increase the life of your knee. Because I see बारिश हो रही है, आंधी तूफान चल रहा है, लोग क्या कहते हैं छाता लेके वॉक कर रहे हैं कि भाई नी रिप्लेसमेंट करा है. That's not needed. That's a message I want to be very loud and clear about.
Don't you think that exercise in general is also a mindset and a discipline towards your personal health?
Oh, it is no doubt on that. Exercising will lead to great, not just physical but mental health also, because it requires you to take out time for yourself. When you take out time for yourself, your mindset should be there. It makes you more disciplined, no doubt on that. But please don't do exercises thinking कि अगर ये exercise नहीं करते घुटना जाम हो जाएगा या joint replacement fail हो जाएगा. That's not how it works. Do exercise so your body in general does well.
So exercise would be to improve metabolic health, maybe mechanical health. Maybe if you have one knee that is compromised, maybe the other one might not suffer, right?
So in a nutshell, I would say this exercise for a patient with a knee replacement or a joint replacement is equally important as somebody without a joint replacement. So people with joint replacement do not have increased need for exercise. That's what I want to say.
Right, right. And what can a patient expect after a knee replacement surgery?
I think a patient should expect a near normal return to function. They should be able to climb, they should be able to sit down, they should be able to move well, their speed should increase. But then these are factors which are not just depend on the knee alone. These are depend on your body in general. So if your muscles are not flexible enough, your brain is a little slow, your cognition is not great, your speed may not increase. Your range of movement may not come. If you're not flexible enough, you may not be able to sit down on the ground. But then that is not a failure of surgery. That's a problem with the body in general. This is what you should discuss with your surgeon before you undergo surgery, your realistic goals. So you should ask, Dr. Saab, what am I going to do after the surgery? What will I be able to do? What will I have difficulty in doing? See, so I have a 50-year-old lady and I've got a 60-year-old lady, I've got a 70-year-old lady. 3 ladies are there. One of them is, the 70-year-old one is a little weight also is too much because body metabolism slows down also. So when these three compare at the end of 6 months, their results, I'm obviously sure that 70 may feel my surgery is not done well. Not because the surgery has a problem. It's because the body is not allowing certain things that a 50 will do. So I see comparison all the time. Oh, डॉक्टर साहब मेरे पड़ोस में उन्होंने करा है, 2 to 3 महीने भाग रहे हैं, दौड़ रहे हैं, मैं थोड़ा पीछे हूँ. So let's stop doing that. If we do that, we're actually comparing oranges to apples. What we should understand is, in your body, according to what your body's limitation or your body's strength, rather than limitation, I'll say strength, you will be able to do everything that the joint was not allowing you to do. So that's how it is. We want your body to be optimized, and you want to do as much activities as what your body would allow to do. That's what the answer is.
Right. No, it's very insightful to have this conversation with you. Thank you for taking out the time. And I think whatever doubts a person might have with regards to joint replacement surgery, I think those mostly have been addressed. So with that, we conclude our podcast. And thank you for taking the time out for this.
Thank you so much, all of you, for listening to us, and thank you for having me here. Thank you so much.
Absolutely.